Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Real glad that you could join us again. Going to be speaking with Dr. Richard Levitan this evening. He's an airway specialist and he's got over 30 years in practice. He's co-founder and executive director of Prone2Help. He's joining us to talk about proning and how it's positively impacted patients with COVID-19. Welcome to Health Professional Radio, Dr. Richard Levitan. Thanks for taking the time.
Thank you for having me.
Well, I mentioned, of course, that you are an airway specialist. Give us a brief background into your area of expertise, and then let's talk about the mission there at Prone2Help.
Sure. So I started out in healthcare as a paramedic, actually, working in New York City. I went on to go into emergency medicine. I trained at Bellevue Hospital in New York, and I ended up pursuing academic emergency medicine at a number of institutions. I was trained at NYU. I went on to Penn in Philadelphia, and then Einstein, Jefferson in Philadelphia. And along the way, I became interested in airway management. I invented a head-mounted camera system that led me to teaching courses. And so I've been very involved with airway education around the United States, around the world, actually, for over 25 years.
Give us a bit of insight into Prone2Help. You're the co-founder of this company, a nonprofit. What exactly is Prone2Help and its mission?
Yeah, so Prone2Help is a charitable organization. What happened was when COVID exploded in New York City in March, I was working up in rural New England where I now live. I work about an hour south of the Canadian border in a town called Littleton, New Hampshire. And as COVID exploded in New York City, and I was in touch with friends of mine who were just amazed at what was happening in their hospitals, that, you know, the emergency departments were just filling up with really critically ill people with remarkably low oxygen saturations, and many of whom had to be put on ventilators. I told my boss up in New Hampshire that I had to go to New York, that I needed to help out, that, you know, we were preparing for COVID to strike rural New England, but it actually, you know, didn't happen. But New York City was just in dire straits. And so I volunteered to work at Bellevue Hospital where I trained. So I went down to New York at the end of March. And as part of that experience, you know, it was just extraordinary to walk into an emergency department as big as Bellevue Hospital, which has, you know, hundreds of beds. And every patient in the emergency department was sick, critically ill with the same disease, which was COVID pneumonia, basically COVID attacking the lungs. And what physicians in New York had figured out before my arrival, but, you know, they had started doing pretty much right as I got there, was that they found that turning people from, you know, from a sitting position to turning them onto their stomach while giving them oxygen via nasal cannula or an oxygen mask, that turning people onto their stomach actually improved oxygen absorption significantly in COVID patients. And with that, you know, the practice of COVID pneumonia, the management of COVID pneumonia really changed, because we initially thought everybody who had the severe form of COVID pneumonia needed to be put on a ventilator. And what we quickly determined was that ventilators didn't help. And if we could keep people off of ventilators, they would do better. But the trick was how to get their oxygen up. And it turns out that proning helped that. So what then happened was, you know, it was apparent on the small, thin mattresses that we have in the emergency department that many patients were not comfortable turning onto their stomach. They just couldn't tolerate being in a prone position for 45 minutes or an hour that we were trying to have them do every few hours to help improve their oxygen. And my son and I were on the phone after one of my shifts, and, you know, we were talking about it, and he said, well, you know, maybe you should use a mattress. And we got to thinking about it, and, well, next thing you know, I had a pregnancy massage mattress shipped to me in New York City, and I started experimenting with these custom cushions that would allow people to lay on their stomach and be more comfortable so that they could tolerate 45 minutes of an hour or an hour of laying on their stomach while using oxygen to help boost their oxygen as a way to avoid intubation, mechanical ventilation.
Are they just a cushion that allows the body to comfortably form into it with gravity, or is it something that changes the way that you're lying prone, like lifting the legs or the head or the chest in a certain way?
Well, so, the interesting thing about COVID is COVID strikes a particular area of the lungs. Basically, it gets the area behind the heart, and it also gets the area in the lower lungs. It attacks those first. So what happens is those areas of the lungs fill with fluid. They don't absorb oxygen. They basically sort of collapse, and large areas of your lung are not getting or don't have the ability to absorb oxygen. So blood comes from your heart, goes to this area of lung that is not working, and then goes back into the heart. And you get these very low oxygen levels because people have a lot of their lung tissue affected by, the COVID pneumonia. When you turn people onto their stomach, you're redistributing blood flow in the lung. You're changing kind of the way the lung can work, and it opens up those areas of the lung most affected by COVID. But what proning cushions do is by elevating the body somewhat, allowing your hips to flex and your arms to fall to your side, and giving you a comfortable place to put your head while receiving oxygen via, nasal cannulas or masks. Basically what it does, it just makes it more comfortable for the patient. And it's a big thing because in some studies that have been done on proning, as many as a third of patients, or even 40%, will not be comfortable enough to lay on their stomach while receiving oxygen to do it for, 30, 45 minutes or an hour every few hours, that they simply are too uncomfortable to prone. So the proning cushions facilitate proning, which helps avoid intubation.
When it comes to these proning cushions, do you think that with these vaccines that are now coming to market, that this is going to be something that is going to be widely practiced and extensively used throughout the medical community?
It's remarkable that, this is the first time in medical history that enormous numbers, hundreds of thousands of patients in the United States, but, literally around the world, millions of patients are being treated with proning, meaning they are put on their stomach with oxygen assistance, but we are using this positioning to help improve oxygen absorption. Now, in ICU patients with severe lung disease who are already on ventilators, it is the standard of care to turn people onto their stomach for part of every day, about roughly half the day or a little less. But they are turned on their stomach while on a ventilator to help absorb more oxygen, to help redistribute blood flow. And, this was discovered in the ICU patients years ago before COVID. But with COVID, we have so many more people affected with severe lung disease at one point in time in human history. And what we've discovered is that awake proning, meaning patients who are not sedated, patients who are not on ventilators, and anesthetized, but people who are just, wide awake on their cell phones, that basically if you use oxygen and you turn onto your stomach, your oxygen absorption is improved, and it's improved significantly. And so all around the world now, this is standard of care. It has been used as a way to either delay the need for being put on a ventilator or to help improve oxygenation, as a temporizing measure. And, in New York City, at the height of the surge, we were seeing, 5 to 10 patients an hour coming in with ridiculously low oxygen levels. And we would put oxygen masks on them, we'd sit them up, and let's say we'd only get to 70 or 80%. And then we turn them, and normal oxygen saturation is above 94. But we would turn them onto their stomach, and their work of breathing would improve, their respiratory rate would go down, they would feel much better, and their oxygen absorption would improve dramatically. So I think initially in New York, where this was first widely deployed, a lot of people were doing it as a temporizing measure. But what we found out, and this was published in an article in May by a fellow named Nicholas Caputo and Ruben Strayer. Nick Caputo's out of the Bronx at Lincoln Hospital, Ruben's at Maimonides in Brooklyn. and I have been volunteering at Bellevue. And the three of us wrote up a series on these patients in the emergency department at Lincoln. And what we found was 2 out of 3 patients who were put into prone positioning with oxygen support, 2 out of 3 got through their hospitalization without intubation. And so, there was this dramatic shift in mid-April where people began to realize it was better to try not to intubate and try to avoid mechanical ventilation. And that's where proning came in.
Doctor, where can our listeners learn some more about proning, about Prone2Help, and tell us how hospitals can request proning cushions from Prone2Help?
Yeah, so when I discovered, that these cushions made it more comfortable for the patients, I actually started getting some sent to the hospital. And my brothers, who are like me, quite devoted to New York City on many levels. My twin lives there. My older brother is there part-time. But, New York is near and dear to our heart. And when I was telling them how amazing it was that we could stabilize these patients without ventilators by turning them on their stomach, but that a lot of patients, especially obese patients and certainly pregnant people, but others couldn't tolerate proning. And, they're stuck in the ER for hours and hours and hours, that these proning cushions made them more comfortable, and it allowed more people to prone, and it would help keep people off ventilators. My brothers asked, how could they help? And so my brother Robert, my older brother Dan, created a foundation, a charitable foundation that's registered through New York State, and it's called Prone2Help. And if you look it up, Prone2Help.org. What we did was we decided we would send out proning cushions free to clinicians. And my brothers started soliciting some funds, initial funds provided by them directly, but then subsequently getting donations from others around the country. And to date, we have, through Prone2Help, sent out almost 1,500 proning cushions to more than 500 hospitals in 50 states. So it has spread through social media, and you can go online, and if you're a clinician, you can request a free proning cushion at Prone2Help.org.
Well, Richard, I appreciate you joining us here this evening, telling us all about proning, how it's helping, and about these cushions as well. Thank you so much for joining us, and hopefully we'll talk again as the pandemic winds down or does what it's going to do.
Well, I am so thankful that the vaccination technology, the progress has gone as well as it has. But between now and I think late April, May, June, when we see dramatic falling in cases, unfortunately, there are 15 to 20 million Americans who are going to get diagnosed with COVID. And what that translates into, is about 1% or so are going to get critically ill. And there are going to be plenty of patients between now and before this pandemic ends who require hospitalization and care. And thankfully, we've learned much more how to keep people alive. The death rates have fallen to a quarter of what they were originally when the surge first hit New York. And what I would tell patients is, if you test COVID positive, monitor your oxygen, get treatment early. And with oxygen support, proning, dexamethasone, we've learned a lot of things how to keep people alive. But unfortunately, we have a rough few months ahead. But like you say, the end is in sight.
Once again, thanks for taking the time here.
Thank you very much for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download it, SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com, Health Professional Radio.